The one thing I did want to say is that it is anticipated that come the fall, there will be an adjustment of the timing of the CAN meetings. So you will be, notified about any changes and suggestions going forward relative to that. Okay, if there is nothing else, I will get right to it. Okay, what I'm going to be talking about today is a interprofessional IDD virtual simulation that we conducted at Villanova on April 17th. I'm assuming that everybody can see my slides. What I want to do is to start with a little bit of history and some context. One of the things that I have said almost from the very beginning to almost anybody who will listen is that Villanova is a little bit different than most of the other schools that are involved in this project. In other words, the 5 universities. So let me give you a little bit of history about that. Villanova's Fitzpatrick College of Nursing is a Catholic institution on Philadelphia's main line. It's about 12 miles due west of downtown Philadelphia or Center City, Philadelphia. Students are enrolled in all types of programs from the BSN up to PhD. Faculty are expected to conduct and publish research just like any other institution and to teach and provide service. The College of Nursing is the only, and this is the thing I keep repeating, the only health-related college or program at Villanova, and it is not located on an academic health or medical center campus. The reason that I think that is important is that most schools of nursing across the country are more similar to Villanova's program than they are to academic health centers. For example, there are 200 at last count, 220 academic health centers in the country, and depending on which source you use, anywhere from 1,000 to 2,600 colleges or universities that offer nursing degrees. So most, as I say, most programs are not, like those on academic, academic medical center campuses. Our faculty have taught and supervised students in multiple settings for many, many years, rarely in settings with individuals with IDD. At Villanova, we have integrated disability in the curriculum for over a decade. The focus, however, has largely been on physical disability, with very limited focus on IDD, with the possible exception of the pediatric nursing courses. We have had standardized patients with physical disability for that period of time, about a decade, and they have been incorporated into live simulations. At Villanova in the College of Nursing, interprofessional education has been based on team steps, which is out of AHCPR, and team steps is integrated throughout the program, undergraduate program, and has been done since 2016. The College of Nursing faculty have worked with the National League for Nursing to make materials on disability, largely physical disabilities, available to others through its website, which is called ACE.D, or Advancing Care Excellence. The last word I heard is that there have been something like over 80,000 hits, and they didn't start monitoring that at the very beginning. In other words, that missed the first 4 years. I'll come back to that point in a little bit. So the overall objectives of our project at Villanova, consistent with the Path PGB IDD project, is to develop a virtual IPE simulation that addresses IDD, but does not require being on an academic health center campus. And it's one we hope that can be used by other healthcare education disciplines and programs. We also had as an objective to obtain input and participation of persons with IDD and family members when appropriate, to engage faculty and students from healthcare disciplines in our approach and our efforts to address IPE approaches to IDD, and to explore the use of the NLN website that I just mentioned a few minutes ago, ACE-D, to ensure that new materials on intellectual and developmental disabilities and the simulation are widely available and the effort is sustainable. When I mentioned that before in terms of the hits, I need to make clear that it's not just nursing faculty and nurses who are accessing the site. Periodically, I get emails from people from medical schools and other healthcare disciplines who have seen the site and they've asked for, some information or permission to use some of our stuff, which of course we always say yes. So it's not just nursing, even though that's where it sits. So the strategies that we use to accomplish, what I just identified are identified here. Starting off with the development of 7 modules. These are brief to prepare students for participation in the simulation. And you can see what the topics are, some of the general ones that you would expect in terms of communication, attitudes, bias, ableism, social determinants of health, all related to intellectual and developmental disabilities. And then 2 that are very specific to IDD. What it is part 1, and select health-related issues in part 2. And then the last of the modules is a note about IDD and autism spectrum disorder. We had feedback and input from an advisory committee who provided input into the topics, and several members reviewed the modules and provided feedback. The school that we collaborated with, I just didn't mean to do that, was St. Joseph's University. It used to be called the University of Sciences. There has been long-term collaboration between Villanova's College of Nursing and St. Joseph University in the past on some other types of virtual simulations, nothing related to disability at all. Fortunately, most of the faculty and facilitators who worked with us had participated in these previous virtual simulations using the format that I mentioned and that I'm going to discuss with you in just a moment. I was not ever involved in any of these, which put me in a bit of a bind because I didn't know exactly how this was going to roll out. People would say it'll work this way. Well, until you're there, until you've been through it, you're really not sure that it really works that way. So it seemed to me, and I mentioned this a little bit later on, it seemed to me that there are an awful lot of moving parts, going on all at the same time, which caused me some angst, I have to admit. So before the simulation, we sent the students, and I'll tell you who the students are shortly, a simulation guide, introductions to read the 7 brief modules that I just mentioned a few minutes ago, and to view a Special Olympics video training that addressed communication largely. We asked the students to complete a pre-simulation 20-item true-false survey and the Roby self-attribution scale of perceived competency and comfort in care of persons with IDD. And I'll say a little bit more about that later on. We provided the students with an overview of the events that were going to happen in the simulation and asked them to read over the scenarios that were in this student guide so that they knew what they were, would be doing ahead of time. And we gave them their pre-assignments to one of 12 groups. We wanted to make sure that there was an equal distribution of students by profession. The professions included nursing students and the students from St. Joe's University who were OT, PT, and pharmacy students. And then we gave them a link with instructions to log into Zoom on the day of the simulation. Faculty who were group facilitators, and again, many of them had done this before, not all of them, had received a facilitator's guide by email with some of the same information that the students received, but additional guidance in terms of their role as facilitators in the simulations. And then faculty too were assigned or pre-assigned to the breakout rooms for the virtual simulation into the 4 different categories. So these objectives are for the simulation itself, which is what it says at the top under the information. What we wanted to do was have, as the students completed the program, summarize the challenges. Would those of you who, would you please mute your microphones, because there's a lot of noise going on at the moment in the background. Okay, thank you. Summarize the challenges that people with IDD face when interacting with healthcare providers. We wanted the students to be able to identify and analyze mechanisms to support people with IDD in those interactions. We wanted them to develop effective communication with people with IDD and or their caregiver, as well as members of the healthcare team involved in their care. We wanted to design strategies to promote positive attitudes about individuals with IDD among all healthcare disciplines. Advocacy was an important part of what we talked about, and obviously interprofessional collaboration, since that's what this is all supposed to be about. So this is sort of the general structure of the simulation. Again, I'm going to go through this in some detail. Up at the top, what it says is pre-session reading and surveys. I think that's what they were supposed to do ahead of time. And then when they came into the simulation, and again, I'm not going to go into much detail here, but this is just to give you an overview. The students moved into one of the 12 pre-assigned rooms. There were about 6 to 7 students in each of the rooms. They started out with part 1. They actually stayed in the same rooms. We originally had another idea, but at the last minute, we had to change it because of some technical glitches. So the first part was an overview. The second part, the students participated in one of 2 case studies and interacted with a person with IDD. And then the final debriefing and wrap up, which again, I'm going to go through each of these in some detail. So part 1, this is where the students started. There was an icebreaker, introducing themselves, and talking a little bit about themselves related to experience with working with individuals with IDD. They then took a look at what's wrong with this picture, which was a scenario that an ED scenario that I can only describe as a debacle, in which Timothy, an adolescent, is brought to this hectic ED from a community event for individuals with IDD. He comes with one of the volunteers from, this event with a probable fractured lower leg, given how his leg looked. He's largely ignored for 2 hours in this very hectic ED. He's spoken about rather than spoken to. The provider and the students, who are not identified by profession, talk over him. So 4 people, 5 people talking at once. The stretcher is bumped periodically. He cries out and becomes increasingly apprehensive, begins hitting himself. Anybody would after 2 hours. The person who's accompanying him is asked how severe Timothy's pain is on a 10-point pain scale. He got no pain relief over these 2 hours. And at the end of the what's wrong with this picture scenario, Timothy is denigrated by the provider to the students with as negative language as you can possibly get. After the students read this, and they should have come into the scenario having read, or into the simulation having read this already, the facilitator moderated the session in which the students in their groups of 6 to 7 were asked to identify problematic issues in the ED, and there are a bunch, identify possible factors causing these issues, and then to consider how the social versus medical model may have a role in what transpired. So that's the first part. It took about 30 minutes. So the second part, the students participated in one of 2 case studies or scenarios. And these are the scenarios. I'm not going to go through them in any detail, but the first one was a 17-year-old female with Down syndrome who was pretty dependent on her mother. She had some weight issues and had lost interest in social activities recently, and a few more other issues. The second case scenario was quite different, which is a 4-year-old child. This is based on the description of one of our members of the advisory committee's son. A 4-year-old child with multiple severe genetic issues that require multiple medical specialists, lots of developmental delays. He had moderate intellectual disability and profound hearing loss. He and his family were learning American Sign Language. This child is on TPN. He's cared for at home by his parents, both of whom work full-time. Actually, the father is in medical school and the mother works full-time, but most of it is from home. And the family was exploring the availability of resources for the future because they anticipated that as he grows up, things are going to change and there may be different needs. So the instructions to the students related to these 2 scenarios was to use principles of communication, interprofessional collaboration, and informed consent and supportive decision-making for adults with intellectual or developmental disabilities, and to discuss the health issues in the scenario and their approaches to addressing them. So they should have been talking among each other from the various disciplines in terms of what they would bring to the scenario. So this was 30 minutes. The second 30 minutes of this part 2 was an interaction with a person with IDD, and we're calling him a standardized patient, although our simulation lab director just recently told me that it wasn't really a standardized patient, but I'm going to use that language anyway. So the standardized patient was introduced by each facilitator to the group. The person with IDD was in the role of a patient new to a clinical practice, and the students were asked to communicate with and get to know the person with IDD, in other words, the standardized patient, and to obtain from that person and/or family caregiver, if present, what would be helpful in future healthcare visits. So it was all communication. So the students, as well as the standardized patients, the people with disability, were given a list of possible topics that might come up. For example, the person's priorities and those of the family in terms of healthcare. Information needed for a patient passport in order to promote positive interactions, such as preferred method of communication, what they want healthcare providers to know about them, how they communicate such things as pain, distress, etc., what they need help with in terms of their self-care needs, previous health-related experiences, good, bad, or indifferent, and the strategies that the person with IDD recommends for future healthcare visits. The emphasis, as I just mentioned, was on the students' communication skills in interacting with the persons with IDD. At the end of the interaction, persons with IDD were asked to provide general feedback to the healthcare students in terms of how they communicated with them, which I think we didn't get much of that, if I remember correctly. So then this was followed by a 30-minute debriefing. The other person on this project is Dr. Betty Mariani, who is on her way to Tunisia at the moment. So she couldn't be here, but she has as an area of expertise simulation. And so previously these simulations, when they were done before, had about 10 minutes of debriefing. And as somebody heavy into debriefing, she said 10 minutes is nowhere near enough and said we need to do 30 minutes. So that's what we did. So the facilitator led debriefing, and again, these were in the groups of 6 to 7 students each, what the students found most helpful. And we wanted to hear from each of the disciplines, the OTs, PTs, nursing, and pharmacy students, what went well, what could have been better or different, what topics made them least comfortable, and what made them most comfortable talking to the person with IDD. How could team work together? How could the team work together to determine if and when to talk to the family rather than to the patient, and to communicate effectively with each other to accomplish the goals for the patient with IDD? A couple of other issues in the debriefing. What are some of the key issues and problems related to communication, interprofessional communication, and certainly we could add, and specifically, with persons with IDD. And then how did interaction with other professionals contribute to care of the person with IDD and what impeded it? So once that was all done, this was altogether a 2-hour simulation. The students were asked to complete a 20-item true-false quiz. This is comparable to, but different than, the original true-false quiz, with a few open-ended questions asking them to share, their views and opinions about this experience. They completed, again, the Roby Healthcare Provider Self-Attribution Scale, which I'll talk about again in just a minute, and explain it for those of you who may not know about this, and then an IPE, Interprofessional Education Survey, the UWE Interprofessional Questionnaire, which unfortunately is very long. It's 35 items. And not all students, very few students actually completed that. Okay, so in terms of the post-test, or the pre-test at post-test. We compared the pre-test and post-test scores on the 20-item true-false quizzes. As you can see, these were not outstanding scores. On the pre-test, the students got 76%, and on the post-test, 77%. And looking over the results, they tended to miss questions that needed to be reverse scored. And so if something was written in such a way, that it said this is not true or something of that sort, then they tended to miss those questions. So obviously there was no difference between those two. And then the IPE survey that I mentioned, the 35-item UWE Interprofessional questionnaire, we don't have any pre-test data to compare our post-test data results to, so we're still looking at those results. And then the Roby Health Provider Self-Attribution Scale. I just went backwards, didn't I? Oh, okay. No, I did go backwards. Okay. So for those of you who don't know the Roby Health Care Provider Self-Attribution Scale, it's a semantic differential scale in which students rate their level of comfort, confidence, competence, anxiety level, a few other things in providing care for these three persons who are identified above. The three brief scenarios were an individual with respiratory infection only. Second one was somebody with a respiratory infection and a physical disability. And the third was respiratory infection and physical and moderate intellectual disability. And this person used an alternate communication approach. On this scale, the students are asked to, did I just go back again? Let me go back again. The students are asked, I'm trying to move this thing and that's what's happening, are asked to select a number between 1 and 7, that illustrates what their level of comfort is. So for example, because it's a semantic differential scale, the left side would be very uncomfortable and the right would be very comfortable. On the left side, it would say incompetent and the right highly competent, just to get, and so they're supposed to select an item or an answer between 1 and 7, indicating where between these two extremes they feel they fit. So then we were able to do a comparison of the pre-test and post-test ratings. It's going backwards again. I don't know why that happens. Okay. So of these three scenarios, in the no disability scenario, the pre and the post rating, self-rating scores were very similar with no significant differences on any of the 6 self-attribution scale scores. And the pre-test and post-test scores on this were 5.5. On the physical disability scenario, the self-rating scores were moderate at the pre-test, 5.4, and increased to 6.0 at the post-test. So there were significant differences ranging from a P of less than 0.05 to several that were less than 0.001. On the physical and intellectual and communication disability, the self-rating scores at pre-test were on the lower side, 4.6. So they seem to be honest in terms of reporting, their level of confidence and comfort. So at that pre-test, it was 4.6. At post-test, it was 5.7, with significant differences, all less than 0.005 on all 6 attribution scale scores, which is very good news, to say the least. Overall post-simulation evaluation, we had 80 students participate in this IPE IDD simulation. 24 of them were from the College of Nursing, and the others were divided among the OT, PT, and pharmacy students from St. Joseph's University. The students also completed a few open-ended responses that indicated that they thought the simulation was valuable, especially the interaction with persons with IDD. The facilitators also provided positive feedback with some suggestions about managing these multiple moving steps, as I call them. Some challenges that we face, the complexity of the format. Maybe it was just me because I was new to this, but it really felt like it was many, many moving parts. And it literally kept me up at night for a while, thinking about how this is all going to work. Moving people in and out of breakout rooms, or even moving them in and just out, requires some technical skill and knowledge of Zoom and that mechanism. And we did not have technical support out of, beyond myself, which was virtually none because I was doing something else, and Betty, who was doing the moving of people in and out and putting them where they needed to be. But it did seem fairly complex, particularly if you hadn't done it before or had not participated in this. It is unknown if and how the simulation will work in other settings, partly because of that. I think some people looking at this might say, oh my gosh, this is like I did. This is way too many parts. I can't keep all this straight. And so we need to think about going forward, what we're going to do, how we're going to make this so that people will see it as something that is workable and not so much of a challenge that it keeps them up at night. Another challenge is the timing in the semester and in the program. Or, should this be considered classroom time or clinical time? We ended up, at least in the College of Nursing, I don't know about the folks from St. Joe's, but we had it as part of the classroom. Part of the clinical, because when we approached some faculty in terms of doing this in the classroom, they would only give us an hour. Can't do all this in an hour. So we had to do it as part of clinical time. And so one of the faculty members lined up all the people who work with her, all the faculty. And so we had, I believe, 4 different clinical groups, which is how we got to 24 nursing students. The other issue is where in the curriculum should this be placed? We happened to put it into the community health course, which is a senior level course, the last of the semesters of their program, which is too late. It should be earlier, and it should not be so late in the semester, because some of the students actually commented on that. It's really late in the semester we're doing this, but it should be done earlier. And we're thinking about that, and need to work with other faculty in order to make that happen. Another challenge, and I think it's a really important one, is the lack of diversity. And we couldn't do anything about the lack of diversity of students. We did have a few students of color, but not very many. But then Villanova is not known for having lots and lots of minority students. St. Joe's, I don't think we had any students of color. And we also had individuals with IDD who were pretty similar across the group. I think altogether we engaged, if I remember correctly, about 10, maybe 8 of the 8 people with IDD. Some cases they participated in 2 simulations because of how the scheduling was done. I wasn't sure if that was going to work. It did for those 2, but I'm not sure it would work for all of the students. But we need more diversity, next time around. In all arenas, we need diversity. We also need faculty buy-in, and we need to have faculty who know something about disability. They need to know something about IDD specifically. And therein lies a big problem. I've been, talking to faculty at Villanova for a decade, and we have had successful, experiences for students, but it's like a handful of faculty are involved, and we need to make this much broader. And so I'm working on that. One of the issues, and I think this goes across anything related to disability, and I think it goes across all disciplines, is people don't know what they don't know, and they think they know. And I think that's huge. And one of the other things which is a challenge, I didn't put it here, I could well have put it here, is I am now a retired faculty member. So I don't have a great deal of clout. Betty Mariani is the Associate Dean for Academic Programs in the College of Nursing, so that helps. But it still requires faculty willingness to participate and faculty willingness to learn about IDD. And that's difficult if people think they already know. I mean, that's a huge challenge that I think we have across the board in many, many different arenas. Our future goals are to refine and simplify the simulation and the procedures going forward, partly for the reason that I mentioned before. If it seems way too complex, we're not going to get, people from other, healthcare professions to buy into this. And so we have to figure out a way so that is simple enough that it's not a challenge, and so that people walk away from it saying, that I can't do that, because I can understand that. One of the things that we want to do is to consider having 2 rather than just 1 interaction with persons with a disability. The students completed, in addition to those surveys that I mentioned before, they completed some open-ended questions. And when asked what they valued the most from the interaction, many of them said the interaction with the person with with IDD. They enjoyed it, they learned from it, they wanted to do more of that. So I think that's an important point. We are in the process of trying to make these 7 modules on IDD available to faculty and students for continuing education credits. In order to get, even if they know already about IDD, which they think they already know, if they want CE credits, they can go through these 7 modules, take a brief test, and get some CE credits for doing so. What we are also planning on doing is to take the IDD simulation, once we revise it and simplify it, to add to the NLN's ASD website. We have been in dialogue with the appropriate people at the NLN to make this happen, so that these, this whole package is available to other schools of nursing and other healthcare disciplines. As I mentioned before, not just nursing faculty have accessed the ASD site in the past, and so this is, so it's not just limited, to nursing. And as I say, we've had some discussion, and we're about to have some more discussion in order to, address this issue. And then lastly, on this slide, is to disseminate all of this to other health professions, programs, and faculty, which of course all of us have to do going forward. So that's my report in terms of what we've been doing, or will be doing at Villanova. If you have any comments, questions, or suggestions, I'd be more than happy to hear them.